I'm here with Bryan Ayars. He is the Chief Executive Officer of Community Health Programs based in Great Barrington in Berkshire County. And sir, thank you for being with us. You are now involved in a multi-week campaign, is really the right word to use, with the Affordable Care Act, the Obamacare as we call it, on the books, the time to sign up. Now, you basically want to make sure that an estimated, I think it's almost 11,000 people in Berkshire County who are eligible to get health care insurance under this program know what's there, and if need be, get the help to get coverage.
That's a great synopsis, Jim. There are roughly 11,000 people in the county who qualify for health insurance or better health insurance than what they currently have. Berkshire County, similar to Hampden County, has very poor health outcomes. It's very important to us that if people can get health insurance, then go see a physician or a nurse practitioner or a PA, that they do that so that their health can be improved. Getting them enrolled in health insurance is just an important way to do it. A lot of individuals depend on their employers for that insurance. More and more employers are trying to minimize their expenses, so they're coming up with more inventive plans. People can enroll through the marketplace that's in Massachusetts now for their own health insurance if their employer is not offering it. And we really encourage them to look at every option that's out there to make sure they get the best deal with the best coverage that they can.
There have been so many media reports going back to the end of last year, both at the national and the state level, all the problems, and there have been real problems with the websites, people trying to get on, sign on. It's a complicated process, even if you don't have a website problem. We had the situation of the president actually having to pull back. He had said nobody's going to have to change insurers. Right. It turns out some people do have to because the plans they had are not considered adequate now under the federal regulations. It's complicated. How much has all of that, do you think, complicated for a lot of folks who, most of us aren't that educated on health care and the intricacies of the program of the Affordable Care Act anyway? Right. We hear all this. How does that get in the mind and make things tougher?
It freezes people. I mean, a simple idea of going to the grocery store to buy a box of cereal, if you don't know the cereal choices, when you go in there, if you look at all the options, you tend to walk away with nothing. Healthcare is more important and more complicated than buying cereal or any other product. People are frozen. They're not acting, and they need to. If they don't act soon, they'll lose coverage. They'll either have to pay a fine, or worse, they'll end up having a large medical debt because they went to the ER or some other place to get care that they didn't have insurance to cover.
And I was fascinated as I read material to prepare for this of who is potentially eligible. I think there are probably a lot of folks out there with what would be considered pretty darn good incomes, but can well fit under the Affordable Care Act.
A family of four earning up to $96,000 qualifies for a subsidy. That's pretty generous, and a lot of people don't think of that. And the health care is not, the government health care plans are not meant for just poor people. They're meant to get everybody into an affordable plan so that they can then afford to go see a doctor, get preventive care, get primary care.
A key to making the Affordable Care Act, or Obamacare, work has always been to get young people, the people that don't think about insurance because they're in their 20s, their 30s. They don't get sick if they're still single. They haven't got a family they're thinking about, little kids they're thinking about insuring. They can be a real tough sell, but because they probably are likely to be well, not use a lot of health care, most of the money they put in premiums stays in and supports the overall system. It's a basic kind of economic plan.
It is, yeah.
We've heard that lately those people are getting more into it, but how critical is that, and how important is it to making it work here?
It's important for the global system that what they've named the young Invincibles get involved in the plans, buy health insurance. It's difficult. I can still remember, although it's been a few years, when I was in my 20s, I was living on my own, I was healthy, I didn't need health insurance. I would rather have that money in my pocket. And I think that's a natural tendency. What we forget is when we need that medical attention, it's really expensive. And it's much better to put 20, 30 bucks away a month or whatever it might be and have that expense covered than end up with $1,000 or $2,000 bill that you have to pay out of pocket.
Let's get down to some of the particulars. The area you serve in Berkshire County with community health programs. We all tend to think, we hear Berkshires and we think of a resort area, pretty well off. We've already talked about the fact that it isn't necessarily lower income people that this is aimed at, that an awful lot of people can be served. But there are a lot of folks who are uninsured in your area. There are a lot of folks that can't get insurance or afford it any other way. How hard is it to get to those folks, do you think?
We shall see. We keep plugging along. We're doing billboards, radio advertisements, word of mouth. Our enrollment specialists are seeing anywhere from 80 to 100 contacts a week with people trying to get more information and get enrolled. The state connector, the maconnector.org, hasn't been working optimally, but it's working. Many of the folks that we're helping were faxing in their applications. So more and more people are interested. As the deadlines approach, they're going to get panicky and start to ask more questions and enroll more. And we're not the only ones in the county trying to enroll folks. ECU Healthcare in North Adams is involved in that. Berkshire Health Systems, through their advocacy for access, is doing the same thing. There are plenty of organizations in this valley that are doing that. We're all working together to try to get as many people enrolled in an insurance plan as we possibly can.
I know you referred to it as a safety net for people who, in many cases, may work several part-time jobs, none of which provide access to health insurance.
Correct. In the Berkshires in particular, while we've got this great reputation as a resort community, that resort is built on the backs of individuals who are working 2, 3, 4 jobs, trying to just get by. And they don't often have the benefit of health insurance or time off with pay. So we offer different hours. We try to be as accessible as possible. And it's important that these folks look to see what they can get for health insurance. They're working for it. They should take advantage of it.
I know you've expressed in some earlier interviews, some of the print media, you've used the word obligation. It's our obligation to make sure everybody knows about this and that nobody is left without affordable insurance.
We can't make people enroll. Some opt to pay the fine rather than pay for insurance. But it's almost a moral obligation to make sure that people understand you have this at your fingertips. You need to at least consider it. If we can help you get over the barriers, we will do everything we can to do that. We can't make you enroll. We can't make you pay or get some sort of benefit either, but we can make you aware of it.
As you go along, as you track this, and I know March 31st is more or less the deadline you're trying for, what's going to tell you you're getting through? What numbers are going to matter?
The following several months will matter as we see people arriving with insurance or without insurance, or calling to say, I no longer have insurance, I need to cancel my appointment. We don't want that. We want people to be able to just not have any worries, come in, be seen by your physician, wherever your physician or nurse practitioner may be, and not worry about the cost.
Bryan Ayars, good luck with the campaign from Community Health Programs in Great Barrington. Thanks for coming in.
Thank you very much.